Hello and welcome to our show Health and Wellness Myths versus Facts. I'm Priyanshi Sharma. Now, made up of the glands that produce hormones, the endocrine system regulates almost everything that happens in the body, controlling growth, puberty, processing food and water, and maintaining the proper levels of blood sugar. Now, the pituitary gland is the master gland controlling all the hormones in the body. If the gland goes wrong, then people can suffer from a range of symptoms and conditions. Now, these are rare and can be tricky to diagnose. So, more awareness is needed to promote diagnosis and better care. Now, in addition to outward physical changes caused by some pituitary disorders, other symptoms directly and indirectly affect not only the patient, but their family and other relationships as well. Now, it has been documented that clinical depression and anxiety are common with pituitary disorders. Pituitary diseases are rare conditions with severe chronic multi-organ and multi-systemic morbidity requiring complex multidisciplinary treatment and usually lifelong treatment. Now, pituitary disorders are the most unseen disorders where people struggle with in daily life. Now, we have invited eminent endocrinologists to provide medically accurate advice on preventing various endocrine conditions related to the pituitary gland and help viewers identify long-term control strategies. Let me take a moment to welcome our guests on this broadcast, Dr. Haritha G, who is a consultant diabetologist and endocrinologist at Dr. Haritha Clinic in Anantapur. We also have Dr. M. Hanumantha Rao, who is a consultant endocrinologist at Aravinda Diabetes and Endocrine Clinic in Ongole. We also have Dr. Semani Chakraborty, who is a consultant endocrinologist at Woodlands Hospital in Kolkata. My first question to you, Dr. Haritha. Numerous glands throughout the body produce hormones. What really are hormones and why are they important for the normal functioning of the body?
Yeah, hormones are chemical messengers that are present in our body. These hormones are secreted from endocrine glands and they act at various levels in the body. We have main endocrine organs: pituitary, thyroid, parathyroid, ovaries in female, and testes in males. And some part of pancreas secreting insulin is also considered as an endocrine organ. These are the main endocrine organs in the body. We have commonly we hear the hormones like thyroid hormones and insulin. These are the common hormones and common diseases we know. Along with that, we have other important hormones, that is the reproductive hormones, testes in the males and estrogen in the females secreted from the gonads, and various pituitary hormones. So, damage to any hormone, so dysfunction of any hormone may lead to various hormonal diseases. So, these hormones are essential to maintain general health and well-being, metabolism, growth and development, reproductive functions, and controlling blood sugars. So, hormones play a very vital role in the health of the body.
Right. And Dr. Rao, what are the different component parts of the pituitary gland and what are their functions?
Yeah, the pituitary gland contains two lobes. Front lobe is anterior pituitary and back lobe is posterior pituitary. This anterior pituitary secretes hormones which is essential for growth, gonadal function and secondary sexual characters and milk secretion. And the posterior pituitary hormones will not secrete any hormone, it will not produce any hormone, but it will secrete, it will release hormone which is produced in hypothalamus. It is essential for water balance. And this anterior pituitary, this pituitary gland attached to hypothalamus by a stalk-like structure, which contains neuronal axons and hypophyseal veins. These are for transmission of transport of hormones from the hypothalamus to pituitary gland. This pituitary gland is essential organ in the body which control many hormones.
And Dr. Chakraborty, now that we've discussed pituitary gland and hormones separately, what is the relationship between growth hormones and the pituitary gland?
Growth hormone is the hormone secreted by anterior pituitary, the somatotroph cells. This growth hormone is important in children for their growth and in adult for maintaining the body composition. The growth hormone is regulated by growth hormone secretion is regulated by hormone from hypothalamus, IGF-1, ghrelin from stomach, and since growth hormone secretion is episodic, also it varies according to stress levels, exercise levels, sleep pattern, all this control the growth hormone levels. This growth hormone, as I've said, is important for growth. So any excess or deficiency can cause diseases. We have growth hormone deficiency, which in children can present with short stature, and in adult, if it's a side effect of tumor, it can present with loss of excess fat mass, then loss of energy. And growth hormone excess, we have a disease called acromegaly, where a patient can present with large hands and feet, dimness of vision, and specific facial appearances.
Right, so those points, of course, important to note. And Dr. Haritha, does the pituitary gland control TSH, and can the pituitary gland cause high or low TSH levels?
Yes, exactly. TSH is a hormone that is secreted from the anterior pituitary. Usually what we commonly see the thyroid profile, when we see the thyroid report, we have T3, T4 and TSH. Actually, T3 and T4 are the thyroid hormones that are secreted from the thyroid gland situated in the neck, whereas TSH is secreted from the anterior pituitary. This TSH controls the production of T3 and T4. So any damage to the pituitary gland like tumor or mass can damage the cells in the anterior pituitary and TSH level may go down. Whereas sometimes excess of TSH hormone can be seen in some rare TSH producing tumors. Then also the TSH may get elevated. So any damage to the pituitary gland may cause changes in the TSH levels. Finally, the TSH is the controller of T3 and T4 thyroid hormones secreted from the thyroid gland.
And Dr. Rao, what is the function of the ACTH, and why is ACTH, that hormone, so important?
ACTH means adrenocorticotropic hormone. This is a very important hormone, essential for life. It releases, it is needed for the growth of adrenal gland, which is situated on the top of kidney. So this adrenal gland releases cortisol. It is triggered by ACTH. This cortisol, widely called as stress hormones. This hormone needed for situations like in stress. It releases glucose. Whenever body needs excessive glucose, or whenever the pressure to maintain blood pressure, the cortisol come into play. So it is very essential for the life. So if any increasing or decreasing levels of ACTH may have major impact on body. So any tumors which causes any pituitary tumor which cause elevated ACTH levels may lead to Cushing's disease. That means it will increase cortisol levels. Ultimately, it will cause weight gain, loss of muscle, that may leads to weakness, muscle weakness, and this high cortisol levels will also decrease the bone marrow, bone mineral density. The patient may get fractures easily, even with trivial trauma also. So whenever when conditions like low ACTH levels, that leads to low cortisol level. That is essential for life. This may lead to hypotension. That means low blood pressure, and hypoglycemia. That means low blood sugar levels. This will all these problems because of the low levels of cortisol. So this ACTH plays a major role in maintaining physiology. So that's it.
So since we're talking about ACTH, Dr. Chakraborty, what causes ACTH to increase, and how does excess ACTH affect our body?
ACTH as Dr. Rao has said, is secreted from the anterior pituitary. It's acting on the adrenal gland to increase the secretion of cortisol, the mineralocorticoid aldosterone, as well as the adrenal androgens. Normally, physiologically, stress is then any infection, inflammation, any critical illness can cause increase in the secretion of ACTH from the body. And disease wise, excess ACTH causes Cushing's syndrome. When the pituitary causes the excess ACTH secretion, we call it Cushing disease, and there is a disease called ectopic ACTH syndrome, where certain tumors of the body such as pheochromocytoma, thyroid tumor called medullary thyroid carcinoma can produce excess ACTH, causing this Cushing syndrome. Now the patients typically present to us with obesity, they have altered fat distribution, they can have fat deposition on the neck, which initially was called as buffalo hump, they can have swollen faces, which we call moon faces, they can have red striae over the abdomen, and also they present with hypertension, they can present with uncontrolled diabetes, low potassium, they can present with muscle loss, and sometimes they can also present with osteoporosis. In females, sometimes excess hair growth in unwanted hair distribution can be caused by the excess ACTH causing rise in the adrenal androgen in Cushing's. And also female may present with menstrual irregularity. Both male and female can present also with infertility. So excess ACTH can be either due to pituitary or unwanted secretion from other glands in specific situations. This causes the Cushing syndrome, where the patient presenting with obesity, muscle weakness and hypertension, diabetes.
Right. Thanks very much, doctors, for answering those questions. We'll pause for a short break now, but we'll continue with more of these important questions on the other side. Stay tuned. Welcome back to our special show, Health and Wellness, Myths versus Facts. Now, we have eminent doctors joining us to help us learn more about the pituitary gland and hormones in our body. My question to you, Dr. Haritha, now, what time of the day is the ACTH the highest, and does exercising increase the ACTH levels?
Yes. ACTH, that is adrenocorticotropic hormone, secreted from the anterior pituitary. Its main action is to stimulate the adrenal gland to release the cortisol hormone. Cortisol hormone is the major stress hormone, that is the hormone that helps the body to maintain and to face the stress of any situation, whether it is usually the physical stress. So, at the early hours of the day, in the morning times, the ACTH secretion will be the highest. Between 6 to 8 p.m., the ACTH secretion will be the highest. And by the end of the day, that is by the evening, the ACTH levels will be lower, because the person is active in the morning and the cortisol requirements are higher in the morning. So ACTH secretion is also higher in the mornings. Cortisol plays a variety of roles. So it almost acts on every cell of the body to face the stress response, to maintain the blood pressure, to maintain the cardiac function, neuronal function, glucose homeostasis, that is to release the glucose during the stress. So all these are the major important functions of the cortisol hormone that are regulated by the ACTH. So the secretion will be highest in the morning and lowest in the evening. Definitely, moderate exercise is a form of stress. So the person has to face the exercise. The ACTH level will go up during moderate exercise or high intensity exercise. So this is regarding the ACTH level and its response to exercise.
Right. And Dr. Rao, what does the melanocyte stimulating hormone do? And in which disease does the excess MSH, in which disease is the excess MSH secreted?
Yeah. Melanocyte stimulating hormone produced in majorly in pituitary gland and also hypothalamus. This MSH or melanocyte stimulating hormone, it induces and release synthesis of the melanin. This melanin is responsible for the skin tone. So this melanin is essential to prevent cancers from UV light in the skin. So MSH is essential, ultimately essential for protecting the skin from ultraviolet rays. So MSH levels are increased whenever we expose it to UV light or sunlight. So it also increased by other conditions like in pregnancy and the persons taking oral contraceptives and diseases like Cushing syndrome. So in those conditions, patients' skin tone might be a little bit darker when compared to previous levels. As we all know, in pregnancy also, the women have darkened skin when compared to pre-pregnancy times. So this MSH is important to protect our skin to getting cancers from the UV light. It is essential to prevent getting cancers, skin cancers. That's it.
Right. So that importance, of course, is important to note. And Dr. Chakraborty, while we are trying to understand pituitary glands even further, what is the relationship between puberty and the pituitary gland?
Puberty is the process when our sex glands, that is the ovary and the testes, become mature to secrete the sex steroids. Now, pituitary controls at what time in a male or female this puberty is going to occur. Hypothalamus secretes the gonadotrophin releasing hormone, that is GnRH, which acts on the pituitary. Pituitary causes secretion of LH and FSH, which further goes and acts on the end organs, that is the testis and the ovary, to cause secretion of the testosterone and estradiol, which finally brings puberty in a male or female child. That is the onset of breast development, the onsets of period, or the onset of secondary sexual characters, the pubic and the axillary hair. So if the pituitary control is not proper, there can be diseases. If a child is having this development of breast before 7 years in female and 8 years in male, we call it precocious puberty. This can be idiopathic, that is without any cause, or due to pituitary tumors. And if the child is not having development till 13 years in girls and 14 years in boys, then we call it delayed puberty. Both these two groups need proper investigation and management, and the parents should be aware of the symptoms so that they can seek endocrinologist advice at proper time. If development occurs earlier, like in precocious puberty, and that puberty is not halted, final height might be shorter. And delayed puberty is also important to treat for proper feminine or masculine development.
But Dr. Rao, if I can come to you with my next question, is pituitary tumor cancer, and what is the best treatment for a pituitary tumor?
Most of the pituitary tumors are benign, not cancerous. Some pituitary adenomas may become cancerous, but it is in these cases are very, very extremely rare. Pituitary tumors, some pituitary tumors may be amenable to medical treatment, like milk secreting hormone tumors. So we have fewer options like medical management, surgical, or radiotherapy. So some tumors are amenable to medical management alone. Prolactinomas, these tumors we can treat with medicine alone. These are curable to some extent. And we have surgical option, transpenoidal surgery is there. It is the invariable the procedure of choice in small functioning adenomas and also most macroadenomas. This is a minimal invasive procedure only. A tube is passed through nose to get access to pituitary gland, and the surgeon will have a look at the pituitary tumor, and they will resect from that tiny hole. This is called transpenoidal surgery. And one more option for treating pituitary adenomas or cancers are radiation therapy. In this, we use high energy X-rays to kill abnormal pituitary cells in the pituitary adenoma. So these are all the options to treat pituitary cancers and adenomas.
As we're talking about the pituitary tumor, Dr. Chakraborty, can a pituitary tumor be treated with medication, and how safe is the pituitary tumor surgery?
Pituitary tumor, depending on their varieties, can be treated by medication. If it's a prolactin secreting tumor, that is microprolactinoma, which causes milk secretion from the breast and menstrual irregularity, the primary treatment is tablet, which we use cabergoline or bromocriptine. And if it's a growth hormone secreting tumor, the primary treatment is surgery, but there are also medical therapies which can help in reduction of the size of tumor, such as octreotide and pasireotide and pegvisomant. If it's a ACTH secreting tumor like Cushing disease, the primary treatment is again transphenoidal transnasal surgery. But some drugs can reduce the symptoms like metyrapone. And primary treatment, that is a transnasal transphenoidal surgery, is generally very safe. The admission and the patient is usually ambulatory after 9 to 12 hours after surgery and can be discharged from the hospital after 3 to 4 days, provided it's done by a high volume pituitary surgeon, that is, who is doing more than 30 pituitary surgeries per year and in a dedicated center. And it has mostly a very good success rate of around 40 to up to 100% success rate of the transnasal transphenoidal surgery. And the indications of surgery is if the tumor is causing, even in prolactin secreting tumor, if it's causing macroadenoma, causing visual compromise, then we go for surgery. Sometimes if the tumor is too large, we can reduce the size with the medical therapy and then go ahead with surgery. In inoperable tumors, then we treat medically or give radiotherapy. And also this pituitary tumors can cause pituitary hormone deficiencies either pre-surgery or post-surgery, which we need to address by treating the hypothyroidism caused by the pituitary tumor as well as the cortisol deficiency caused by the pituitary tumors.
Right. Well, thanks very much, doctors, for joining us in this important discussion and answering those questions. We hope that this helped our viewers learn more about the hormones and about the pituitary gland in our body. With that, it's a wrap on this show. Thanks very much for watching. Goodbye.